This is the Unacademy Doctors, and I am your educator for Biochemistry, Dr. Shivangi Shukla. I welcome all of you to tonight's session of the day. This is the second session Mnemonics, as well as images, as well as one image per day. Okay, today is the second day in the series. Let me just check if the live stream has started and if I'm audible clearly. Just give. Okay, great. So, yesterday we discussed a mnemonic regarding the beta oxidation of fatty acids, isn't it? How the acetyl carnitine molecule is, how the acetyl CoA molecule is transported through the inner mitochondrial membrane, through which it is normally impermeable, isn't it? The acetyl CoA molecule is normally impermeable through the inner mitochondrial membrane. It cannot pass through the inner mitochondrial membrane. But what happens is the carnitine is the carrier group that can transport it through the mitochondrial membrane also. Okay, discussed this yesterday, the story mnemonic, the story based mnemonic. Tonight we shall be discussing about mnemonics on mucopolysaccharidosis. That is extremely important. Okay. So I'm your educator. We have been together for the past 3 months since this channel has started, isn't it? I'll just quickly brief you about the iconic as well as the plus subscriptions for Unacademy or for NEET PG on Unacademy. Okay, there are two types of subscriptions for NEET PG Unacademy app. One is the plus subscription and the other is iconic. Now both of these will give you access to video lectures from top educators across the country. They're live as well as recorded classes you can access while on the go, while sitting anywhere on any device of your choice. Okay, it your laptop, your tablet, your phone, your PC, anything, whichever you wish to, whichever you're comfortable with. Okay, and you'll also get access to printed PDF notes, so that while taking the classes, your only focus is on understanding and you do not waste time on taking down the notes like this, okay, which happens in the classrooms. Okay, the iconic subscription will also give you access to resources from Prep Ladder as well. Okay, also please do not forget to put in the educator code DRSHUKLA Dr. Shukla, which will fetch you an additional 10% discount over and above the already subsidized prices. Please do not forget to put in the educator code Dr. Shukla while you are checking out on this page. Also, one very important announcement. We are coming up with an educator branded quiz for biochemistry that I have prepared specially for you guys, and it has a lot of attractive prizes, and this will be conducted on the 25th of February, so please stay tuned to that. To enroll for that test, whenever the link comes in, you have to use that, click on that and subscribe, enroll using my code, that is DRSHUKLA. The enrollment is absolutely free. Any one of you, even if you don't have the Unacademy app, just download it and then you can enroll for that session, and you will get a lot of attractive gifts, and the questions are really very, very unique. So please attend that. You will benefit a lot from that. Stay tuned on 25th of February 2020. Okay, just a couple of weeks ago. Okay, so please brush up your biochemistry and attend that. I'm telling this to you in advance. Okay, so the mnemonic for the day that we have to discuss is regarding Muco Polysaccharidosis. Okay, now first of all, let me give you a background of Muco Polysaccharidosis. What are these? They are Doses. Oses means they are diseases. Pathology. Saccharide, that means related to sugar or carbohydrates. And poly means multiple. Poly means multiple. That means polymers, okay, or polysaccharides. So what are these? They are glycosaminoglycans. That means they are polysaccharides. Now how do you remember? Do you remember from the chapter on glucose, we said whatever ends with ans, ans, the suffix ans, it is for polysaccharide. Okay, and the suffix os, it is for monosaccharide. Therefore, what did we learn? We learned hexosans. Hexosans are what? Polysaccharides containing 6 carbon residues. Here what did we read? Hexoses. That means monosaccharides with 6 carbon. Isn't it? Like glucose. Okay? Understood this? So, what are glycosaminoglycans? They are polysaccharide because an aa gaya, an is polysaccharide. So, these are polysaccharides containing repeating disaccharide units. Okay, so polysaccharides with repeating disaccharide units out of which at least one is an amino sugar. What is it? An amino sugar. Okay, that is why amino sugar. Understood? This is how you, so this is in itself a mnemonic. This is how you utilize, how you break down words in biochemistry. Okay, break them down to their roots. Okay, so mucopolysaccharidosis are a group of inheritable inborn errors of metabolism. Okay, where they are usually autosomal recessive, so they are precipitated by consanguinity. Sanguinity is marriage amongst blood relatives. Okay, and what else? They affect multiple areas wherever connective tissue is present. Why? Because what is the component of connective tissue? Connective tissue or extracellular matrix is composed of structural protein. Structural proteins are collagen, elastin, and fibrillin 1. Okay, then specialized proteins. These are laminin and fibronectin. And third is proteoglycans. Proteoglycan, again, glycan is polysaccharide containing an amino group. Okay, now what are proteoglycans? If you ask me the definition of proteoglycan, proteoglycans are compounds containing glycose aminoglycans with a core protein linked covalently. So how many definitions have I told you? Before even starting with the mnemonic, I have told you so many important definitions, isn't it? What is proteoglycan? Glycan means polysaccharide. Polysaccharide, what polysaccharide? Glycosaminoglycan. Proteo means it has a protein moiety, which is the core protein that is linked covalently to glycosaminoglycan. Okay, so this is what proteoglycans. Now, what happens is glycosaminoglycans, as you would be knowing, is present everywhere in the connective tissue. Connective tissue is present at so many places. So mucopolysaccharidosis is going to affect a lot of tissue, the joints, okay, skin, face, liver, heart, ear, eyes, so many places. Okay, understood? Got it? So this is how this mucopolysaccharidosis affects. Okay. So now let us start naming the different mucopolysaccharidosis. Okay. The first one is Hurler's syndrome. Okay, this is the first mucopolysaccharidosis, Hurler's syndrome. Second one is Hunter's syndrome. Okay. Now the name and the numbering we'll read here. And here we'll read what is the major urinary metabolite. That is, mucopolysaccharidosis, what happens is the degradation of these glycosaminoglycans is affected. Then these glycosaminoglycans get deposited because they're not getting degraded, so they are deposited everywhere. Okay, and that is what leads to deformities. Okay, now and then when they are getting accumulated in the body, they are excreted through the kidney also, because they're getting accumulated and they affect the kidneys also then. So in both Hurler and Hunter disease, in both of these, the main urinary metabolite, that is the major glycosaminoglycan that is getting deposited, is which one? It is header. Is it? Header. Header. What is this? This is heparin sulfate and dermatan sulfate. Before that, I'll just quickly enumerate the different glycosaminoglycans that are there. Important glycosaminoglycans are hyaluronic acid, keratin sulfate 1 and 2, dermatan sulfate, heparin, heparin sulfate, and chondroitin sulfate. Okay, understood this? So these are what we are going to read, various mucopolysaccharidosis, which of these are present. So in Hurlers and Hunters, you saw that header is getting accumulated. What is it? Heparin sulfate and dermatan sulfate. In Hunters and Hurlers both Hurlers and Hunters are phenotypically very similar. There's just one point of difference, and that is corneal clouding. Corneal clouding is present somewhere, and it is absent in the other one. How will you remember that? A hunter is someone which needs to have a sharp vision. Hunter needs to have a sharp vision, so his cornea should not be clouded. So a hunter who needs to hunt should have a sharp vision. The corneal clouding will be absent. In hurlers, corneal clouding will be present. This is a very important point of difference. It has been asked quite a lot of time in PG entrances, so please. Okay. Now the third one is San Filippo A. This is 3A, 3B, 3C, and 3. What are all these? Very easy. San Filippo A, San Filippo C, and San Filippo D. Okay. Now San Filippo sounds like sand filter, isn't it? Sand filter. And there is another other type of filter that is usually seen in North India, highly polluted city. That is not just North India especially in winters, because in winters there's a lot of smog. So it is present everywhere, but this filter is present everywhere naturally. But usually in North Indian cities, North Indian homes, it is usually seen extreme winters when smog is what is available. That is the HEPA filter, isn't it? The air purifiers use HEPA filter. So HEPA, sand filter, HEPA filter, sand filter, HEPA filter. What is HEPA filter? HEPA filter is heparin sulfate. In all these four, heparin sulfate will be the major urinary metabolite. Understood this? Now, the next one is, so this one was 3A, 3B, 3C, 3D. The next one is 4A and 4B. Okay, 4A and 4B are what? Morchio A and Morchio B. This is the easiest. Morchio, just when by hearing you would know what is the mnemonic I'll be using. Morchio sounds like mosquito, isn't it? Mosquito A is alpha mosquito, mosquito B is beta mosquito. Okay, so this is alpha mosquito, alpha male, so alpha mosquito, it is stronger. This is the mnemonic that I am writing. This is beta mosquito, it is smaller, it is the beta. Okay, now what will happen, and it is weaker. So what will happen? This can penetrate. What does mosquito do? It penetrates the skin through its proboscis. So this is penetrating not just the skin but also the cartilage. So what will it do? The skin has keratin sulfate plus chondroitin sulfate. Both chondroitin is present in cartilage. But this one, since it is weak, it is smaller, so its proboscis can only go skin deep, and it only has keratin sulfate. Understood? Got it? Next, the next one is 6, Marotolami. Marotolami, the only one with 2 words. 2 words means double the words. Double words means words is double words, right? Double words in the name. Double from D is dermatin. So what does it have? It has dermatin sulfate. Understood? And the 7th one is sly disease. What is it? Sly. Sly is 1, 2, 3. 3 letters. 3 letters. That means all the 3 apart from the mosquito wala. Because mosquito is the only one जो keratin में जाएगा, skin में जाएगा. Otherwise कोई नहीं जाएगा skin में. So dermatin sulfate, heparin sulfate, and chondroitin sulfate, all 3. Understood the mnemonic? So this is it for Muco Polysaccharidosis. Let us remember, let us try and recall, revise. Let us revise this again. I'll give you 5 minutes. I'll give 5 minutes to each of you. Write this down, okay? Write this down starting from hurler, hunter, San Filippo, A, B, C, D, then Morchio A, Morchio B, Marotolami, and slide. Okay, so please write this down along with the mnemonic that I have mentioned, and then we'll discuss. Okay, I'm giving you 5 minutes to write it down. Okay, do it. Come on. Come on, everyone. Write it down. It's last 2 minutes left. Try and write this quickly. The mnemonic that I have given you regarding the polysaccharidosis. Hurler syndrome, Hunter syndrome, Sanfilippo A, Sanfilippo C, and Sanfilippo D. Then comes Morquio A, Morquio B, Maritolami, and Sly disease. So, what are the different glycosaminoglycans? Hyaluronic acid, keratin sulfate A 1 and 2, dermatin sulfate, heparin sulfate, and chondroitin sulfate. Now, starting with the first and the second, hurlers and hunters. The first one is hurler, second one is hunter. Both of them have urinary metabolites as heparin sulfate. Metabolites. Now, why will they occur in the urine? Because they have accumulated in the tissues. So, now since they have accumulated, because they are not getting degraded, they are getting accumulated and then they will be excreted as such in the kidneys. Okay. So, Hurler disease and Hunter disease both have header. Header is what? Heparin sulfate and dermatin sulfate. Okay. Then comes Sanfilippo A, Sanfilippo B, Sanfilippo C, and Sanfilippo. Sanfilippo sounds like what? Sanfilippo sounds like sand filter. So one sand filter and the other, another filter that you have heard of is in air purifiers, it is heparin sulfate. It is HEPA filter. So in sand filter, you have HEPA filter, Sanfilippo, you have heparin sulfate. One important thing between hurlers and hunters, one has corneal clouding and the other doesn't. The hunter needs to have a sharp vision for hunting, so his cornea will not be clouded, his cornea will be clear, his cornea will be transparent. There will be no corneal clouding in hunter's disease, there will be corneal clouding in hurler's disease. Okay, Sanfilippo, heparin sulfate. Next comes Morquio A, Morquio B. Morquio A sounds like mosquito, Morquio B sounds like mosquito, Morquio A is alpha mosquito, Morquio B is beta mosquito. Alpha mosquito is stronger, like alpha male, it is stronger, so it will penetrate not just the skin or the keratin in the skin, but also the cartilage or the chondroitin in the cartilage. Therefore, it has keratin sulfate and chondroitin sulfate. Whereas Morquio B is beta or beta mosquito, it is smaller, it is weaker, it will penetrate only the skin, it will not penetrate the cartilage. Got it? Only keratin sulfate. Now, penetrating the skin is the property of only mosquitoes, so keratin is present only in mosquito diseases, that is more. Okay. Then comes Maritolami, only mucopolysaccharide with double mucopolysaccharidosis with double words, double dermatin sulfate. Then comes Sly disease. Sly has 3 letters S, L, and Y. So we have we have already discussed that keratin will only be present in mosquitoes. Sly in mosquitoes as in mosquito diseases. So Sly contains the rest of the three, that is dermatin, heparin, and chondroitin sulfate. Okay. I hope you have understood the mnemonic. I hope you have followed this. Okay. this was about mucopolysaccharidosis. I hope you guys follow this. You guys have understood it is a very, very important topic, guys. What is a proteoglycan? What are the different components of the extracellular matrix? What is the connective tissue? What is an extracellular matrix? You have to define also. Okay, so it's the component. It is the component that is present in between cells, and it leads to stability of the cells, and it also leads to movement in between cells. Okay, movement of nutrient substances in between the cells. It helps in that. It is composed of structural proteins, it is composed of specialized proteins, and it is composed of proteoglycans. These three types of biomolecules comprise the extracellular matrix. There are three types of structural proteins: collagen, elastin, and fibrillin 1. There are two types of specialized proteins: laminin and fibronectin. And the third one is the proteoglycan. What is a proteoglycan? It is a polysaccharide which contains glycosaminoglycans linked covalently to protein. What is the difference between glycoprotein and proteoglycan? Glycoprotein is essentially a protein. Okay, proteoglycan is essentially a glycan. No, you will recognize them by their surnames. Okay, their surname is the last, is the suffix. So proteoglycan is a glycan, that is, it is a polysaccharide. Glycoprotein is a protein. Now, proteoglycan has a protein group attached covalently, a core protein attached covalently to the glycosaminoglycan, and glycoprotein has a carbohydrate moiety attached to the protein. Okay, got it? Like the hydroxylysine residues of collagen are glycosylated, leading to carbohydrate moiety being added to the collagen structure, which makes it a glycoprotein. But elastin is not a glycoprotein because the lysine residues are not glycosylated or hydroxylated. Understood this? Getting it? And regarding mucopolysaccharidosis, they are inborn errors of metabolism that are inherited mostly in recessive fashion. And there are different types we have already understood, and what are the different glycosaminoglycans which are accumulated there. And what are glycosaminoglycans? They are polysaccharides containing repeating disaccharide units, out of which at least one is an amino sugar. Okay, the other one can be a uronic acid group, it can be an additional group like sulfate, and the others also. Okay, got it? Now I hope you have understood today's session. It is extremely important. Using this Mnemonic, we have understood a major part of the extracellular matrix chapter. If you have any doubts, you can ask me. Otherwise, we can conclude this session. Okay? Got it then, guys? Let us then conclude the session. I'm leaving it open for you to discuss your doubts. Let us please ask me your doubts in the next 1 minute. Otherwise, I'll just conclude the session. Okay, I hope you have found this interactive enough. You have found this interesting enough and beneficial. Okay, tomorrow we'll come up with another session. And please stay tuned to the session, to this channel. Do subscribe to this channel for regular updates regarding different sessions. I'm taking 2 YouTube sessions daily and 1 Unacademy special class daily at night. That is an MCQ session. And do remember, there's the biochemistry test coming up, an educator branded quiz that is coming up, where you will get a lot of attractive prizes. And so please start brushing up your biochemistry, revising your biochemistry. Go and attend all my previous sessions fast, because the test will be conducted on 25th of February, and you have the chance of winning a lot of attractive prizes. So please stay tuned to that. Okay? Alright then, guys. See you soon. Bye-bye. Take care. Good night.